Hi.
Everyone. So my
Um,
name, oh,
yes.
you go ahead.
No. I was gonna be like, it's Tuesday night at the end of the month,
The last Tuesday.
last Tuesday.
So my name is Bailey. I'm the therapy coordinator with West U Pediatric Dentistry with Dr. Pia Gandhi. And then the last Tuesday of every month, Gina Hawney, our in-house s- speech therapist, feeding therapist extraordinaire, Mary Poppins bag, and I hop on and talk about a topic that's been burning in our minds or a FAQ that we get weekly, daily from all the patients that we care for. Um, so tonight we're going to be diving into a topic that is really important to both of us, which is introducing allergens to babies and young children. We know that food allergies are on the rise across all the different types of allergens, and a lot of parents feel nervous about how and when to introduce everything from peanuts to soy to dairy or eggs. So if you feel comfortable, leave a comment or leave a question of something that's been on your mind, and we'd love to answer them throughout the live. Um, so tonight, Jean really is going to be discussing a lot of the newer research instead of the old school way of thinking on how to introduce allergens and the more up-to-date research on feeding therapies and how they can be a great resource.
Thank you. And I definitely want to make everyone aware, like, I am not a doctor.
Right.
I'm a speech language pathologist. Of course, you should be working with your pediatrician or your allergist. And so I just want to have that disclaimer of that. Uh, I'm not giving you specific recommendations for the allergens, but we are going to talk about how it is involved in feeding therapy
Yes.
and why, starting off with the first one, like, why is introducing allergens early so important? And how I feel like more and more people have heard this. Like, they
Yeah.
know, they're like, okay, I'm hearing it, but I'm still so scared,
Hmm.
right? And so we know based on the research that, the AAP is really recommending to do it early on, soon after 6 months. We want to be
Yeah.
starting some of these allergens. You can look on my Instagram page. I just did a whole thing on all 8 allergens and some ideas of how to introduce them. I even did some blog posts and a podcast on this for more information. But we used to think that waiting until 2 or 3 years of age was the best. And now that we found that is totally false. Um, and actually, we want to introduce early to prevent the food allergies.
Yeah.
Uh, Something that I have found is that really important for parents to know is that if you introduce something early on, like eggs or peanut butter or whatever, you have to keep doing it. And,
Yeah. So it's
and
not like a
that,
one and done.
yeah,
Oh,
and
we
that
tried it once.
absolutely. So if you tried eggs at 6 months and you're like, oh, okay, my kid's not allergic to eggs, and then you try it again at 12 months and you get a reaction, like, no, it doesn't work that way. You have to keep introducing it. You have to keep part of the diet,
Hmm.
those allergens. Uh, so that's really important. And then, as a feeding specialist, I can help with this. I know, shocking, right?
Right.
Like,
Right.
I never actually really get referrals from allergists, but I do wonder if they know that feeding therapy can actually help carry out their plans
Mm.
when they have some. So we know that some babies have feeding challenges, and that
Yeah.
makes it harder to introduce those allergens.
Hmm.
And that's where I come in. That's where I can be a help. I can do it virtually. I can do it in your home. If you live in Houston, you can come to my office in Houston, and I can help you find a safe and developmentally appropriate way to introduce that food that you want to introduce.
Yeah.
So I really want people to know that a feeding specialist can be super useful. There are times where a parent will ask me a question. I'm like, you need to talk to your allergist, your pediatrician,
Hmm.
or you might need to find a dietitian that is well versed in allergens, because they might be able to help with like specific recipes that meet the nutrients of your baby. So
Hmm.
I'm not a one-stop shop, but I know I can do a lot. Uh, yeah, I think something else to bring up. So we talked about a little bit with research why research about how introducing early and often is important. We want to also address that a food allergy is when the immune system reacts really strongly to that food. And this can look like hives, swelling, vomiting, or even trouble breathing. Okay, so that's a food
Hmm.
allergy. Something else that gets confused with food allergies is a food intolerance.
Okay.
This is different. And this is when the body has trouble digesting the food. And this might look like bloating or diarrhea, gassiness, or some mild skin irritation. So there's
Oh,
a difference, but sometimes people get them mixed up and like
yeah.
their baby has, massive diarrhea from
Hmm.
drinking milk
Hmm.
and they're like, "Oh my God, they're allergic." No, 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 no. They're just their body is learning how to digest this.
Okay.
So those symptoms often get a little bit confused.
Yeah.
And we want to look for signs of reaction, of course, and keep track of it, but that doesn't mean we should avoid the food necessarily.
Hmm.
So, introducing allergens safely. I see a lot of babies right now introducing solids, and I'm really encouraging parents to pick an allergen that we're going to start introducing. And funny enough, you want to do it early in the day. Don't do it right before nap time. Don't do it right before bedtime. We want to pick a time that your baby is healthy and happy. Another really important thing to note is you don't
Oh.
want your baby to be like having some other signs of symptoms of a cold, and then
Hmm.
you confuse it with, an
Yeah.
allergen. Don't introduce allergens if your baby is cold or fussy, has a cold or is
Yeah.
fussy. We want to start with small amounts and wait 10 to 15 minutes, see how they're doing. Uh, I don't generally recommend mixing too many allergens for the first time at that same meal. Meaning, like, if we're going to introduce eggs, let's not put cheese on it if it's the first time we're eating cheese,
Mm.
also. So, like, if you're going to do eggs, do the eggs.
Hmm.
Uh, you know, Now when you feel like you're in the clear of the eggs, absolutely let's add in a little bit of that
Right.
dairy, whether it be yogurt or cheese, and then and see how they react. How do I help you if your baby is having feeding challenges? So if your baby is struggling with textures, we can modify how it's introduced. And this is where I think outside of the box a lot with my parents. I love going to people's homes. We can play chef. Even on
Hmm.
virtual, I could be like, okay, go get this food from the kitchen. Let's do this, this, this. For example, like, don't use crunchy peanut butter. Use, be surprised. Use smooth peanut butter. We only need a very small amount. We can mix a small amount in with some food that your baby likes. Like, it doesn't have to be complicated.
Hmm.
With picky eaters, this is one that I do find can be a little difficult, right? So many parents will, be like, oh, they refuse certain foods. Oh, they won't eat eggs. They hate eggs or whatever it is. And the
Yeah.
allergist is saying like, no, we need to work on eggs. And so this is ways that I can help, or a nutritionist, a dietitian can help with certain recipes, and then I can help you introduce it to your baby in a very positive way, whether if we have to do a sensory approach
Hmm.
to the introduction of
Yeah.
food, or maybe a little bit of a behavioral approach, like we try one little bite of this and we get to do XYZ, something
Hmm.
like that. Food allergies can lead to a lot of anxiety
Yeah.
around eating, and not just for kids.
Hmm.
It's worse for parents. The
Yeah,
parents,
for sure.
their energy really does go on to their child, and children hear you, right? If your 2-year old constantly hears you, well, he can't eat that, he can't eat that, he can't eat that, then when you finally are ready to feed your child that food, he already thinks he can't eat it.
Yeah.
So we have to be very careful with the
I
terms
have
and
a
the word.
friend that her son is allergic to chicken eggs, soy, and beef. And I'm like, that is an interesting combination.
I wonder if that falls under. This is where I wish I had an allergist to talk about this, but does it fall under mammal products or something like that?
Oh,
Something with
oh,
There are some interesting food allergens related to beef,
Hmm.
beef especially, and so interesting.
That is interesting.
Um, but yeah, I bet you an allergist would be able to figure out why that is.
Yeah.
It's coming from that. It's something with that animal. But wait, you said beef, chicken, eggs, and what was the other one?
And soy. So he was on like, I
Well,
think he was on
now
like a
I
goat milk
wonder if it
formula.
has to do with the protein, if he actually has trouble breaking down the protein of these products. But I don't
Mm.
know. We'd have to talk to the allergist. And if the allergist is like, hey, we can't avoid beef
Right?
forever, and the child has already developed an anxiety around it, then Gene can help you. We can figure that out. Um, okay, so the role of the feeding therapist in managing allergens. As a feeding therapist, as I mentioned, I help families introduce the allergens that is developmentally appropriate to
Hmm.
the child. If a baby struggles with texture, we're going to modify the foods. If a child has a scary reaction, then we're going to work on building that confidence up.
Yeah.
If I can collaborate with allergists and pediatricians to create a feeding plan, and I am there with the parent to help carry it out. So the
Hmm.
parent doesn't feel alone in this,
Right.
right? Um, so now we have like some common questions that I was wondering. You said you had some common questions that parents often ask.
Yeah. So I got a couple new ones once we sent out the posts and the stories that the topic this month was going to be allergens. And then some more kind of common questions that I've had from a couple different families that have seen you in the office that do have allergies. So how do we introduce allergens if the baby's already hesitant on eating solids?
Okay, so during my evaluation, right? We're starting from the beginning. We're going through all the case history, whether it's breast or bottle feeding. We ideally can find something that the baby is willing to eat, some type of familiar texture,
Hmm.
whether that be a puree or even a crunchy food, right? We're
Right.
we're we're gonna find something that baby likes,
Something.
and then we can pair the allergen to that food that they
Hmm.
are already eating. But also be aware of like, does it taste good? Do we think it mixes well?
Yeah.
Although, as someone that likes to cook, I have some interesting concoctions of food that people would be like, that's crazy. That would never go well together. And it actually surprisingly does. And with babies, generally, a good eater is a good eater. So, like,
Hmm.
you could give a baby who's a good eater anything to eat, and they'd be willing to at least taste it.
Right.
So, and all we need is a teeny tiny taste of that allergen for the first few times.
Yeah.
But yeah, that's pretty easy for me to help a parent with.
Nice. If my child has eczema, should I introduce allergens differently?
Sometimes I'll see babies who have eczema just from whatever milk they're drinking,
Okay.
whether it's breast milk or formula, right?
Yeah.
And in those cases, oftentimes I find that the pediatricians are, or the dermatologist or possibly an allergist, or they have a protocol to keep the eczema from flaring up. But we
Hmm.
don't, in many cases, we usually don't know why the eczema is
Right.
occurring.
Hmm.
Could it be environmental? Is it something in the milk? Like, we just don't know. But ultimately, with these situations, we want to take extra care,
Hmm.
extra observation. Definitely don't give the allergen before bed. We want to make sure the baby does okay with the food allergen because they are possibly at a higher risk. But that doesn't mean
Okay.
we don't
Doesn't mean we
give
don't
it. Like, we still
do
need to
it.
do it.
Yeah.
So we may have to introduce the allergens in a smaller amount at first and gradually work up. But always, of course, talk to your pediatrician too, and they can provide more insight.
Hmm. How can we balance allergy safety when and also prevent picky eating?
One of the top three rule, no, one of the top three recommendations for picky eating is exposure. Try,
Hmm.
try again, right? Some kids, you expose them 10 times and sometimes it's 50.
Yeah.
So we have to keep offering, with a safe food. Exposure is key. That's with all picky eaters. even if they can't have dairy, we can find similar textures to that.
Oh.
And
Oh.
that was kind of the thought I was having earlier with one of my patients who has a dairy allergen. So we're using Coco June, which is a
Mm.
coconut milk based yogurt. And so
Yeah.
now the allergist is talking about introducing dairy, and we've already got our yogurt. So introducing just a little bit of a dairy milk yogurt
Mm-hmm.
is going to be so easy for this kid. Like he's not even going to notice it's in there.
Because you've already worked on
We've
the texture component.
already been working the texture and even the flavor. The
Yeah.
Coco June plain tastes like Greek yogurt
Oh.
plain.
Oh.
It's a little bit thinner,
Mm-hmm.
but I often tell parents, like, if you don't know what food to give or what's on the market, if you live near a Whole Foods, spend an hour there at least and
They've got everything.
just peruse. And you just have to look at the labels, and you have to try things and be willing to spend some money and it not work. But we
Mm-hmm.
have to try it or we'll never
Yeah.
know.
Yeah.
But yeah, so working on that. But that is sometimes where I have to go through, like, okay, what are the textures we're already eating? What are the
Mm-hmm.
goal allergens that we want to introduce? How can we start moving on that?
Yeah.
So that was a good
Mm-hmm.
one.
Can a feeding therapist help with the oral motor skills if my child has trouble eating allergens in solid form?
Interesting. And this makes me think that maybe the allergens have been presented in another form
Mm-hmm.
and they've tolerated it. And this is kind of the same approach I would do for texture grading, which is a type of method to get kiddos from like a preferred food that is maybe soft and mushy to something that they have to chew more.
Yeah.
But I guide parents in the safest way to introduce those allergens, right? Especially for babies with feeding delays, texture versions, history of choking and gagging. And we just have to figure out where they are, what is our goal food, and go kind of in small little steps to the goal
Mm-hmm.
food.
Yeah.
Did that answer
I think so.
pretty much? Okay. I
I mean,
feel like it
I
did.
figured it'd be a similar approach to kind of the oral motor
Yeah,
skill
the picky
workouts that you
eaters
have
and stuff like
normally.
that.
Yeah.
Now, don't get me wrong, sometimes like when I really see a chewing delay, which
Uh-huh.
I do often see in toddlers who are stuck on purees, who
Mm-hmm.
avoid lots of foods and textures, I still have to do my oral motor evaluation and work on the chewing hierarchy. But
Got it.
here's the thing, you can't work on chewing if you're not willing to put the food in your mouth.
Yeah.
So, baby
You gotta
steps.
start somewhere.
And so, yeah, and I will let you know when we are ready to work on chewing. But sometimes we have to work through the sensory components or the anxiety first.
Yeah. Yeah. Now, did you have some questions that you got or like different statements from some of the doctors that you coordinated with, right?
Okay, yeah. So I was talking to one, and so what I feel like would be a great collaboration with allergists and even pediatricians, right before, even if the kid doesn't go to the allergist, is when should a doctor be referring to a feeding specialist?
Mm,
And if a doctor is recommending something to benefit the child, whether it's a type
yeah.
of therapy to introduce an allergen, and the child refuses that food or has a very limited diet, they need
Hmm.
a feeding therapist.
Yeah.
And earlier the better, because it only gets worse as we continue into toddlerhood. And then in theory, the allergy could possibly get worse too, because now we're really avoiding putting it in our body. And then what are some red flags in feeding development that might indicate need for feeding therapy? So kind of to tag on that one, we have if they're refusing to eat the allergenic foods, and
Hmm.
then if we notice difficulty chewing, swallowing, we're gagging, we have strong aversions to other foods, even if we're refusal to self-feed past 12 months, vomiting with foods that don't even include the allergens. Like these are all things that are red flags that I would hope would benefit from. I mean, I know they would benefit
Right.
from feeding therapy,
No,
but that the
yeah.
parent would get the referral or the
Hmm.
recommendation to start
Hmm.
feeding therapy.
Yeah.
Um, How was it for you when you were doing allergens with your children?
Well, so Michael and I, so my husband and I both have food allergies. So
Like
he
what?
we're both allergic to orange, pineapple, grapefruit, kiwi. I'm allergic to kiwi. He's allergic to
Is it
mango.
a rash?
So he breaks out in full body hives
Okay.
and like difficulty breathing the whole 10 yards. Mine is prompt GI
Okay.
issues in both directions. Kiwi, I get a rash in on my face and in my mouth, but that's the only one that I get a rash with. But both of us having the allergy to orange, grapefruit, and kind of things in that like tropical category outside of lemon and lime, I was super anxious to give orange juice because we don't keep it in the house. They had zero exposure to it at home, at a restaurant with us, anywhere. And we go to pick them up from my mom's house one morning, and I pick up their cup and I was like, what is in here? Like, we are a water family, period. They got that cup was a water cup, period. Like, if they had something else, it was in an open cup. I'm like, what is in here, Mom? She goes, oh, we had orange juice this morning with donuts. I go, they had orange juice? And I'm like freaking out inside, like, how do I not flip out in front of my 1.5 year old and baby? Like, how do I not freak out right now? And it took her a minute. She goes, oh gosh, you are allergic. And they were fine. They've had zero reactions to
To
anything,
any fruit?
any food, period.
Did you ever feel like, or your husband, with all those allergens to all those tropical fruits, and like wanting to seek help from an allergist to get over some of them?
For ourselves,
Yeah.
it never really occurred to me.
I mean, it just depends on how important it is in your life, like, and how important it is in your social life, right?
Yeah.
Because if it's like peanuts, that's an
Hmm.
important one, right? I think even eggs,
Yeah.
sesame, these are
Yeah.
foods that are gluten, wheat. Sometimes with gluten, I get it. If you have celiac disease, you're like, I'd
Yeah.
rather avoid the gluten than deal with the repercussions.
Yeah.
But with some of these other things, I mean, it's fascinating. But imagine if you lived in a tropical environment,
And it was
maybe
everywhere.
you maybe you would be more motivated to seek treatment.
Yeah.
But now with the people that I collaborate with and talk to, there's some really amazing things going on in the allergy world, that they're busting all these myths of
Hmm.
old school approaches.
Hmm.
And you just, as I tell parents, like, you have to find a really good allergist who's willing to hear you out and help hold your hand a little bit, develop
Yeah.
a plan. And I'm like, listen, if you could just develop the plan, I'll hold their hand. Like, I'm cool with that. I will do it. Just
Yeah.
please communicate well
Hmm.
and be available for questions,
Yeah.
because I'm going to have questions because I'm not the doctor. Um, but see, look at that. But again, even with peanut butter, which is so many parents like worst nightmare, I've said, I'm like, just bring the peanut butter to the pediatrician appointment. Like, let's just get over this
Yeah.
somehow, right? Like, we can't keep living in fear, especially if we're withholding a food and the baby doesn't even have an allergen.
Yeah. So
Do you
I
agree?
think for peanuts, and I'm like, looking back, it was pretty silly because when I was breastfeeding both of them, my breakfast, my go-to breakfast was oatmeal with a quarter cup of peanut butter and a sprinkle of chocolate chips to like get me through the day and have like a little perk me up first thing in the morning. So they were exposed to peanuts from birth. And when it came time for them to eat it, I was like, oh no. Oh no, it's going to be a day that we're going to the pediatrician anyways. I'm going to do it 30 minutes before we leave the house. So if something serious is happening, then I've got time to rush them to the ER. And nothing happened.
But I mean,
Nothing happened.
you made a really good point. Like the food you ate while breastfeeding, I do see quite a few babies that, you know, have had fussy periods, whether it's with breast milk or formula or on special formulas. And
Hmm.
so even with those kiddos, like we'll talk to the pediatrician just so that we're all on the same page, but we still want to introduce those allergens in
Yeah.
some way, even if they have, because also we know as babies, they go through fussy periods and
Hmm.
sometimes we assume it's an allergen
Yeah.
or an
Yeah.
intolerance. And most of the time, parents tell me they outgrow it.
Hmm.
I hear that all the time. But the parent, the mom, holds that food from her diet for a while, whether it's dairy or eggs or or nuts or whatever. And so then they
Hmm.
have to reintroduce that one. It's
We
super
we
fascinating.
were very lucky. We were very lucky for the first year and a half. The girls saw my pediatrician. I went to Steve Alley over in Memorial Hermann before he went on sabbatical, and his bedside manner was in such a calm, hold handing way for me because that's what I needed. Are you allergic to peanuts? Well, no. Okay. The likelihood of her being allergic to
Yeah,
peanuts is exponentially low. If you have concerns, let's have the conversation. Let's include an allergist. Let's include a dietitian.
yeah,
And I was like, okay, well, you think we'll be fine? He goes, you're going to be fine. Good
right.
parents don't worry if they're being good, if they're doing a great job. You're doing fine. And so
Yeah,
it was comical of, well, I gave her peanut butter an hour ago and we haven't seen anything. He goes, are you allergic to peanuts? I go, no. How often do you have peanut butter? Well, every morning in my oatmeal. He goes, okay, so she's been
yeah,
exposed to it since the moment she came out of the womb. Go, yes. Yes, she has.
yeah. And even in the same room as you, right?
Hmm.
And the children that actually, interestingly enough, I've heard this from specialists, but the children who have the really extreme peanut allergies is pretty rare. And
Yeah.
yet in all our schools and so many environments, it's peanut free.
Yeah.
And so it's, a fascinating topic that I I just well, I keep wanting to learn more about, and
Hmm.
learn from our specialists. But yeah, find yourself a good specialist if you or your child is suffering from allergens. There's a lot of cool therapies out there. And, we covered a lot tonight: why allergens matter, how to do it
Hmm.
safely, how feeding therapy can help. If you're unsure about allergen introduction, I'd love to help. I can do it virtually or here in Houston. Um, you can go on my website at www.thelittleeaters.com, book a consultation, email me. And I'm also on Wednesdays at West U
Wednesday
Pediatric
mornings, every
Dentistry.
Wednesday.
You can message Bailey and yeah, check out my website and my podcast for more
Yes.
information on introducing allergens.
Hmm.
And this was fun. Thank you.
It always is. It was great. I always learn
Awesome.
something new too. It's
I
fantastic.
know it's good teamwork, and I love your insights as, like, we're both moms. We've both been through this, and we have different possibly mothering techniques,
Hmm.
and so not everybody does things the way I do it or you do it or however. And so we're here to help each other and collaborate.
Yeah, it's a good village to have.
Yeah, that's
Awesome.
right. Okay,
Well,
thank you,
enjoy your
Bailey.
Tuesday. Bye,
Yes,
guys.
good night. Bye.